We've come to a time in human history that's really unprecedented in the sense that, especially for people living in wealthy nations, we have all of our survival needs met. We have more leisure time and more disposable income than ever before in the history of humankind, including for the poorest of the poor. We have more access to luxury goods. You would think that we would just be happier than ever. But the truth of the matter is that we have exploding rates of depression, anxiety, addiction. If you look at world happiness surveys, people are ranking themselves as less and less happy in the last 20 years in the wealthiest nations of the world. And ultimately, my hypothesis about that is that it is overabundance itself, which is a modern stressor, that our brains did not evolve for this world of overabundance. And as a result, we're trying to compensate for an environment or an ecosystem that we were really not designed for.
Welcome to the Mindset Game podcast. It is a huge honor to have Anna Lembke here with us today. Anna, thank you so much for joining us. I want to share a little bit about your background for those that are not yet familiar. Anna is a professor of psychiatry at the Stanford University School of Medicine, and she's the chief of the Stanford Addiction Medicine Dual Diagnosis Clinic. A clinician scholar, she has published more than 100 peer-reviewed papers, book chapters, and commentaries. She sits on the board of several state and national addiction-focused organizations, has testified before various committees in the U.S. House of Representatives and Senate, and keeps an active speaking calendar. And on a personal note, Anna, I know you know that we met through the Genius Network annual event where I got to hear you speak, and it really transformed many things that I thought about when it comes to addiction and so on, that I'm really excited for you to share with people today. In 2016, Anna published Drug Dealer MD, How Doctors Were Duped, Patients Got Hooked, and Why It's So Hard to Stop. Oh my gosh, what a title. Which was highlighted in the New York Times as one of the top 5 books to read to really understand the opioid epidemic. So thank you for your work on that. Anna recently appeared on the Netflix documentary, The Social Dilemma, an unvarnished look at the impact of social media on our lives. And she's also the author of the incredible New York Times bestseller, Dopamine Nation, Finding Balance in the Age of Indulgence. Highly recommended to all of you. And that explores how to really moderate compulsive overconsumption in our dopamine overloaded world. And of course, we'll talk more about that. And really exciting, Anna just came out with the official Dopamine Nation workbook, again, available wherever books are sold. And I'm certainly excited to get my copy of that. Thank you so much for taking the time to be here with us today.
Oh, you're welcome. I'm excited to be here.
So share with us a little bit about what do you mean by Dopamine Nation?
Yeah, great question. One of the main ideas of the book is that we've come to a time in human history that's really unprecedented in the sense that, especially for people living in wealthy nations, we have all of our survival needs met. We have more leisure time and more disposable income than ever before in the history of humankind, including for the poorest of the poor. We have more access to luxury goods. You would think that we would just be happier than ever. But the truth of the matter is that we have exploding rates of depression, anxiety, addiction. If you look at world happiness surveys, people are ranking themselves as less and less happy in the last 20 years in the wealthiest nations of the world. And ultimately, my hypothesis about that is that it is overabundance itself, which is a modern stressor, that our brains did not evolve for this world of overabundance. And as a result, we're trying to compensate for an environment or an ecosystem that we were really not designed for. And that's kind of what I'm getting at with the title.
Thank you. And I imagine that everybody listening has experienced that overabundance. It's so interesting. It's almost like a lot of people now want to minimize, simplify,
Yeah.
all of these things. It's like the pendulum swinging to the other side.
Yeah.
Um, and so tell us a little bit about dopamine and of course its connection to addiction, because oftentimes there is an addiction to the overabundance. We've been conditioned for that. Can you share a little bit of the research on that?
Sure. So, dopamine is a chemical that we make in our brain. It's very important to the experience of pleasure, reward, and motivation. It's not by any means the only chemical involved in that process, but it is the final common pathway for all reinforcing substances and behaviors. And neuroscientists have come to use it as a kind of common currency for measuring the addictive potential of different substances and behaviors. Namely, the more dopamine that's released and the faster that it's released, the more likely that substance or behavior is to be addictive. Also, there's a whole bunch of really fascinating work looking at the changes that occur in the brain over time as people go from recreational adaptive use to maladaptive addictive use. And one of the most salient findings is that those individuals manifest a dopamine deficit state. So their level of dopamine transmission in the reward pathway looks to be below that of healthy control comparison subjects, which is really interesting because you would think, well, we're bombarding our brains with all of these stimuli that release dopamine. Shouldn't the people who are using these substances and behaviors more have higher levels of dopamine? But the fact of the matter is that through the process of neuroadaptation, our brains respond to all of this external dopamine by downregulating our own dopamine transmission. For example, by involuting postsynaptic dopamine receptors as just one potential mechanism. So the result is that we're probably walking around, in a dopamine deficit state, which compromises our ability to take pleasure in more modest rewards and means that even our drug of choice is probably not giving us as much pleasure as it used to because we've changed our hedonic or joy set point. Now we need more potent forms in more abundance, not to feel pleasure, but just to feel normal and stop feeling bad. And so it's very fascinating to look at that process in the brain and the ways that we're kind of having to adapt to an unhealthy ecosystem.
Thank you for sharing that. And I think it's absolutely fascinating, the way that the brain works in that sense and its impact. And it brings a lot of like, I think, compassion and like understanding to a lot of people that are struggling with addiction, and things that used to be enough are not enough anymore. So it's even more extreme, whatever that form of abundance or soothing is. And these over attachments, we see them all the time. It could be even like, I know a lot of the listeners who are very driven, may have an addiction of sorts to success, right? To getting the clients, to or to golf, or to, it doesn't necessarily have to be like to drugs or alcohol. We would sometimes typically think of as addiction. Addiction comes in many, many different forms. So can you tell us a little bit more about just the concept of addiction, these over attachments and how they impact us?
Yeah, I mean, so addiction, broadly defined, is the continued compulsive use of a substance or behavior despite harm to self and or others. There is no brain scan or blood test to diagnose addiction. It's really based on what we call phenomenology or patterns of behavior that manifest over time and look very similar across different people from different cultures, time periods, and even across different substances. And that phenomenology is essentially that people reflexively approach pleasure and avoid pain. That's in our hard wiring. And if we find something that gives us pleasure or gets us out of pain, we will do it again and again. And if we have access to a whole lot of that substance or behavior, and it's very potent and releases a lot of dopamine in the reward pathway, Over time, it will work less and less well. We'll need more of it in more potent forms. And eventually, at some point, it will be harmful in the sense that it will hijack our reward pathway and lead us to invest all available resources into getting the drug, using the drug, overcoming using the drug, maybe hiding using the drug, and then starting the cycle over again the next day, or maybe the next hour, depending upon the drug, if it's really short acting. And so, that is what we mean when we distinguish like a passion or a hobby from an addiction, right? It's that it's by definition maladaptive. Now, people will use that term colloquially all the time. Oh, I'm addicted to romance novels, or I'm addicted to this, this wordplay game, or whatever it is. It's maybe not a life-threatening problem, but I think if we examine our behavior more closely, we can see that most of us, let me say many of us, if not most of us, have something in our lives that we do more often than we'd like, for longer than we'd like, to the detriment of other activities we'd rather be doing or that we committed to doing, possibly to the detriment of our values and morals, to the detriment of relationships. And those are the kinds of signals that we want to look for, as well as if we're lying about it. So that's not in the DSM. It's not one of our diagnostic criteria, but it is a soft criteria I look for clinically. Once we start lying about our behaviors, either minimizing use or maximizing use or lying altogether about our use, we're in the danger zone.
Yeah. Yeah, and it's important to pay attention to those warning signs so that, as you said, we're not going to dip further into that. Tell us a little bit more of the research behind more the hereditary side, nature kind of side to addiction relative to nurture or environment.
Yeah, so we have, reliable data, especially for alcohol use disorder, that if you have a biological parent or grandparent who had an alcohol use disorder or has an alcohol use disorder, you are at increased risk for an alcohol use disorder yourself compared to the general population, even if raised outside of that substance using home. So those are powerful data points because they really tease out the difference between nature and nurture. So like in adoption studies, for example, will show somebody raised in a teetotaling house or in a house where there was no modeling of addictive substance use, no trauma, that person still is at increased risk to develop an alcohol use disorder because of their genetic heritage. In terms of other types of genetic or inherited risk factors, those also exist. So, for example, a personality trait of impulsivity, that is having difficulty putting a pause between the thought or desire to do something and doing it. We know that is associated with increased risk of addiction. Also, people who have co-occurring psychiatric disorders, especially things like attention deficit disorder, bipolar disorder, and other mood disorders, PTSD, those are highly comorbid with developing an addiction. The exact pathway is probably a feed-forward cycle in the sense that people with psychiatric symptoms may be more likely to turn to substances to try to self-medicate their psychiatric symptoms, but also using addictive behaviors and substances can also create psychiatric symptoms and make pre-existing symptoms worse. So it's sort of in both directions.
And I've heard you share that addiction is also in part about or associated with controlling emotions, not feeling, the effects of uncertainty, chaos, stress. Tell us a little bit more about that.
Yeah, so this is a topic that is of a lot of interest to me. You could almost conceptualize all addictions as an addiction to control, and are wanting to be able to predict in the next moment what I will feel and what I will think, even if it's not good. At least if I know what's coming, that is a relief to me. And there's a whole very fascinating branch of cognitive neuroscience related to cybernetics and information theory and active inference that actually posits that organisms teleologic motivation, that is their reason for their behavior, is to minimize surprise or maximize control, which I think is really fascinating and has a lot to say, with this intersection of addiction. I have just thinking one particular patient who had struggled with, the traditional kind of drugs and alcohol, but ultimately got addicted to nitrous oxide, commonly called whippets, which has a very fast onset, very fast offset, doesn't leave, at least for the user, they have the sense it doesn't leave much residual. Like you can just get high for 10 minutes and then go drive your car, right? So you're not hung over in that sense. In fact, there is a huge residual. It causes significant brain damage through B12 pathways and other pathways. But importantly, what this individual was communicating to me was that for her, that ultimately became her drug of choice because of the control piece, because of the way she could have this fine-tuned control. So yeah, it is, there's our desire to be in control of our experiences, a huge, huge motivator for almost everything that we do, to our detriment when we take it too far.
Yes, exactly. As you said, when it's taken too far. And I know certainly, in terms of the work on the unconscious mind and all these things, we know that they're very deep protective systems. And that might be kind of what you're seeing in the research as that need to control and manage and have some certainty in an uncertain world.
That's right. Yeah.
And so, can you share with us a little bit more about your metaphor of the teeter-totter?
Yeah.
Because I know that was really helpful to me, and I sense that it will help people better understand their own behaviors and other people's behaviors.
Sure. So a very simplified way to think about what happens in the brain as we get addicted is to imagine that deep in your reward pathway, your nucleus accumbens, there is a balance or a scale, not unlike the one that you have behind you, or a teeter-totter on a central fulcrum. And when it's at rest, it's level with the ground, and it represents how we process pleasure and pain. Pleasure and pain are co-located in the brain, so the same parts of the brain that process pleasure also process pain, and they work metaphorically like opposite sides of a balance. When we experience pleasure, it tips one way, pain the other. There are certain rules governing this balance, and the first and most important rule is that the balance wants to remain level, or what neuroscientists call homeostasis, such that any deviation from neutrality is actually a stressor on the brain. It causes release of cortisol and our own adrenaline. But also importantly, with any deviation from neutrality, our brains will work very hard to restore a level balance. So for example, I have a glass of wine that releases dopamine, my balance tips the side of pleasure, but no sooner has that happened, my brain adapts by downregulating dopamine transmission as a way to bring me back level again. But it does that first by tilting an equal and opposite amount to the side of pain. And I like to think about that as these little neuroadaptation gremlins hopping on the pain side of the balance to bring it level again, but they like it there, so they stay on until tilted an equal and opposite amount. And that's the hangover, the come down, that moment of craving, wanting to have one more glass of wine, even though I promised myself I would stop. Now, if I am able to stop, then the gremlins get the message that their job is done. They hop off and homeostasis is restored. But if I continue to consume my drug of choice, whatever it is, whether a substance or behavior, over days to weeks to months to years, those gremlins multiply, they get bigger and stronger, and eventually they're camped out on the pain side of the balance. And now I've entered addicted brain, right? Now I've changed my hedonic or joy set point. My drug stops working. I need more of it in more potent forms, not to get high, but just to level the balance and feel normal. And importantly, when I'm not using, I'm walking around with a balance that's tilted to the side of pain, right? I'm experiencing the universal symptoms of withdrawal from any addictive substance or behavior, which are anxiety, irritability, insomnia, depression, and craving. And I think understanding this metaphor is really helpful for understanding how we can experience that hijacked brain, where all of a sudden we're marshaling all available resources to get our drug and use our drug, because behind that is this very powerful physiologic drive to restore homeostasis as quickly as possible. And within some range, we can achieve allostasis, which is to say we're always adjusting to our external environment. It's what makes human beings in particular so incredibly flexible and adaptable. So we make adjustments all the time. But if we make adjustments outside of the zone of what is feasible for a given organism, now we've entered, a kind of a maladaptive response. And that's essentially what happens with addiction. We just overwhelm the capacity of our pleasure-pain balance to reset itself to restore baseline levels of homeostasis, which are necessary in order to preserve a supple pleasure-pain balance, to be able to respond to changes in the environment, whether pleasurable or painful.
So what I'm hearing is that it's very difficult to make the right choices or to be resilient when we're entered into that addictive brain, because there's more momentum kind of, against, if you will, those right behaviors, those right thoughts, and so on. So what do we do if we're in that place where either it's the mild, so we're not quite in the addictive, brain yet, but we are feeling more of a pull to whether it's eat the chocolate or smoke the cigarette or binge on Netflix, whatever that might be. What do we do to prevent it from getting to the addictive phase? And also, of course, what do we do if we're already there?
Yeah, so a couple of things. First of all, we have to acknowledge that we live in a world of overwhelming overabundance, which is itself a modern human stressor that our brains were not evolved for. And we have to engage in what I call self-binding strategies. That is creating both literal and metacognitive barriers between ourselves and our drug of choice, so we can press the pause button between desire and consumption. If we rely on willpower alone in this world, none of us will be successful. So this is things like getting our particular drug out of the house, minimizing use to certain days of the week or only for special occasions. This is things like being totally transparent with others, radically honest about what we're using, how much and how often, so that we can also maintain awareness and don't get into this state of denial where not only are we lying to other people, but also lying to ourselves about exactly what we're doing, how much and how often. So all these kinds of self-binding strategies, and people can be very creative about these things. So I've had patients lock their smartphones into a kitchen safe that they can't then access until the next morning. There are these devices which you can attach to your phone, so that it can't transmit or receive for a certain set amount of time. People who are, get the potato chips out of the house or the alcohol out of the house, who run water over their cigarettes and then throw them away so they're not likely to go into the garbage and get them again. When traveling, calling the hotel in advance and saying, please get the minibar out of my room, or even please get the television out of my room, or disable the television, right? So I'm less likely to be able to consume when I'm in my own little rat's cage, which, hotel and motel rooms often are for us. So all kinds of strategies that can anticipate the limits of our own willpower, try to create an environment that is conducive to better choices before we're actually in that situation and already in a state of craving. And then the other thing, borrowed from Alcoholics Anonymous, which I just love, is HALT. HALT stands for hungry, angry, lonely, and tired. So recognizing that when we're hungry, angry, lonely, or tired, we're much more likely to be in our limbic lizard brain, and reaching for substances and behaviors to, change the way that we feel, in order to reset those reward pathways. So kind of really respecting the limits of our own physiology, which, by the way, this environment also conspires against us, right? Where we have all these lights that keep us up past our natural bedtime, that wake us up before our natural bedtime. We have all this stimulation coming in through these devices that wake up our brains beyond what our brains really have the capacity to process in terms of the information that we're taking in. So, really kind of respecting the physiologic limits of human beings.
And also loneliness, of course. I mean, my
Right.
gosh, that's a whole epidemic in and of itself, of just
Right.
that sense of feeling lonely, even if we're with people virtually or in person, just that feeling of And that can even intensify the more we look at it from an organizational perspective. Usually it's even lonelier at the top. Um,
Yeah, loneliness and boredom is a huge one. I hear all the time from patients that boredom is a huge reason they use in the first place and a big reason they relapse. And it's partially because we live in such a, in many ways, sterile and controlled environment that, I mean, it actually is, life is more boring, right? There are not many people on the street doing things, everything is kind of hyper controlled and organized, so there's that kind of a yearning for spontaneity, a yearning for, in kind of a way, a yearning for sort of chaos.
Wow. And that brings to mind, again, this polarity, right? Of, let's say, chaos and stability,
Right.
noise and quiet, or silence, light and dark, and that, as you refer to it, that dialectic aspect to life that is,
Right.
it's there in all areas of life. Tell us a little bit more about that. And then, of course, I would love to go back to a little bit more tips on people who are experiencing addiction.
Yeah. So, I mean, I think, the dialectic is so powerful, right? This idea that every force has an equal and opposite force, and that for us to be healthy, we really need to be drawing from both ends of whatever the polarity is. If we go too far in one direction or another, if we get out of balance, we're going to be unwell in all the ways that we can be unwell. So, yeah, that's really the point is how can we be in balance when we're living in a very unbalanced world that is not encouraging balance. So, and I think people are really feeling that and wanting to be more in balance.
So, what if we ourselves or our loved ones are suffering from addiction?
Well, for folks who are struggling with serious addictions, I would recommend seeking out the help of a mental health professional who's specifically trained in addiction. And I really emphasize the latter because I think sometimes if folks are not trained in addiction, they might not focus on the addiction. I'm talking about mental health care providers, and instead might keep looking for underlying reasons for the behavior rather than focusing on the behavior itself. I am guilty of this early in my career. I never even asked patients about drug and alcohol use. And, I had patients who were, I know for a fact were struggling with addiction and never brought it into the room because I didn't ask for it because it's stigmatizing and shameful. But it wasn't on them to bring it up. It was me as their psychiatrist to ask about it. And I didn't do it because I myself was ignorant and also fearful about the answer because I didn't have the tools or the training to intervene. So, but seeking out a mental health care provider with that training, going to a mutual help group like a 12-step group, Alcoholics Anonymous, just checking it out. They are open meetings, listening to people's stories, seeing if that resonates. And then, of course, for milder addictions, mild to moderate addictions, you can always do a kind of self intervention, which is an earlier intervention we do in clinic, which is a dopamine fast, right? Try giving up that drug of choice for 4 weeks. Why 4 weeks? Because on average, we find that's the amount of time it takes to reset or begin to reset reward pathways, to get some insight into the behavior, to get out of this vortex of craving and begin to feel a little bit better, to get the frontal lobe back online, talking to the limbic brain. So, as long as folks aren't at risk for life-threatening withdrawal from their drug of choice, which would warrant a higher level of care, this is an experiment that people can do. And it can be very informative. Number one, if we set a goal of abstinence and we don't achieve it, that might give us important information about just how addicted we really are without having realized it. It also, I think, elicits a lot of empathy for the problem of addiction in others when we experience that withdrawal ourselves and that craving. I know that that's true for me when I gave up romance novels, which I developed a minor addiction to, and then decided to give up and was really struck by how hard it was for me. Um, and, really importantly, if we're able to get through the first 10 to 14 days, which are typically very difficult, and we can get to weeks 3 or 4, we kind of come out of the tunnel and have the experience of thinking more clearly, feeling less emotionally dysregulated, having more serenity, having more insight. and then realizing, oh, wow, that behavior really isn't good for me. People can't really see that when they're in it. You have to get some distance from the behavior to get that insight. And then even if folks then choose to go back to using their drug of choice, usually they want to use differently, they want to use less. And so making a specific plan for how to do that.
So for those 4 weeks, is it complete, abstinence, so to speak, from that? Or could it be less or not as frequent?
Yeah, so it's a great question. In general, if people are able to abstain completely, that is often easier, believe it or not, than trying to just reduce use. Although how to abstain from certain types of drugs can get very complicated. So if it's a technology and internet addiction and the person needs to be online for their work, which most of us do, how do we do that? One of the ways to do that is to say, okay, I'm never going to use my device to change the way I feel or for entertainment. So that can be a really nice sort of line. And when we're really paying attention to that, it is striking how much I personally, for example, use my device, even something like checking email, to change the way I feel or for entertainment. So if I'm really going to commit to not doing that, it's going to be hard, right? Especially initially. For others, it might be something like, oh, I'm not going to use pornography, or I'm not going to play video games, or I'm not going to go on Twitter, whatever. They can be self-defined. For food addictions, it typically looks like I'm going to abstain from sugar, or I'm going to abstain from processed foods or from carbohydrates, the kinds of very quick, high potency, high calorie, high fat, sugar, salt kinds of foods that are so addictive. So that's typically what we recommend, because the abstaining allows us to kind of begin to reset reward pathways. Now, sometimes patients will say, well, I smoke cigarettes and I use cannabis, which is my medicine, and I drink alcohol. So I don't really want to give up cannabis, but I do want to stop smoking cigarettes. And my alcohol isn't a problem. Well, then, the dopamine fast would be giving up cigarettes and not necessarily giving up alcohol or cannabis, unless one was very tightly associated with the other. So if, for example, drinking alcohol triggered the crave for cigarettes, then that person might want to give up alcohol and cigarettes for that month. Or if they usually combine cannabis and nicotine together in a spliff, they might want to give up both for a month. If they decide to just give up the one and not the others, the key there is not to increase use of the others, right? That's the problem of cross addiction, kind of whack-a-mole problem, where we stop one addictive behavior, but we really just transfer the behavior to something else. We don't want to do that.
So as you were speaking, right, I'm thinking about my addiction to chocolate. It's a real thing.
Yeah.
And so, even just the thought of completely not having any of that for 4 weeks, I mean, I could feel my body just as I was entertaining that thought, like rebelling, like, no way. So what can we do? What are some proven ways to calm our nervous system, to even give us a chance to follow through? In addition to, of course, as you said, getting our environment there. So, getting things out of the house, talking to people. Like, what can we do to soothe the inner parts of us to be able to follow through on our commitment?
I think one really important thing is reframing the project, because typically the way that we frame it is that I am denying myself my reward. And this is going to be really awful. And then I'm not going to have a reward in my life, and I deserve a reward. I think a reframe is, I'm actually going to be doing something that is really good for me and that my body will thank me for. And although it will be difficult initially, it will be worth it. So that's one important thing. The other important thing is to just also recognize that the hard part typically is time limited. So although initially it will be really hard, that's true, and you don't want to minimize that. Believe it or not, the longer you go without chocolate, the easier it will get. It's so paradoxical because we don't feel that way about it. But honestly, the more days you can accumulate without chocolate or whatever your drug is, the faster you will get to that place where you're not even thinking about chocolate. You don't even want chocolate. Maybe even the thought of eating chocolate is kind of repugnant or repellent, because we hear that all the time from people, whether it's chocolate or cigarettes or what have you. So there has to be this reframe where thinking about it not as depriving myself, but actually giving myself a gift. And then recognizing that although it's difficult, it's only difficult for a relatively short period of time for many people, not for all, but for many.
So do you recommend like replacing that with something else? Like, let's say instead of chocolate, I will allow myself something to have that is healthier, maybe that has healthy sugars or something like that in this example. Or is there a concern of then overindulging? And the other thing, as you said, this cross addiction thing, like, is it helpful to replace, like, let's say if somebody has an addiction to golf. So instead of that, they're going to watch golf on TV instead of go play, or I don't know, something like that. Was that helpful or is that worse?
Yeah, it's a great question, and it's a very nuanced answer. So, in general, it is good to think of alternative, healthier behaviors, what we call approach behaviors, things that we want more of in our life, as a replacement for the behavior that we want to avoid. But we have to be very clear that those approach behaviors are not themselves so reinforcing that we risk getting addicted to them. So for example, if like instead of allowing myself to eat this cupcake, I'm going to watch a Netflix series. I mean, Netflix is like moving visual image movies. Those are really potent drugs for a lot of people. That's not necessarily an improvement there, right? Or I'm going to let myself play video games, whatever it is. Much better is the kinds of hard-won approach behaviors that maybe don't feel so good right in the moment, but that make us feel better later. Like reaching out to another human that we haven't talked to in a while and making a connection that we really maybe don't feel like doing. Like, I don't want to call this person, or I don't want to go out of my house, but kind of making ourselves do the things that are harder as a way to kind of get a healthier sources of dopamine that are longer lasting.
Mhm. So tell us a little bit more about that, like positive sources, healthier, adaptive sources of dopamine.
Well, I mean, in this stage, almost everything has become drugified, making us more vulnerable to getting addicted to it. But in general, it's things like exercise without overdoing it, right? You can get addicted to exercise. A lot of, type A personality people now do, so that's no good. But like modest, moderate exercise, that's in balance with your level of fitness, that doesn't overdo it and lead to injury or cause significant opportunity costs. That's a really good way to get your dopamine indirectly. And the way it works is essentially exercise is actually immediately toxic to cells, but the body senses injury in response to exercise and then upregulates feel-good neurotransmitters like dopamine, but also norepinephrine, serotonin, endogenous opioids, endogenous cannabinoids, without necessarily going into that dopamine deficit state. So those levels of dopamine can remain elevated for hours afterwards before going back down to baseline level positions. Other examples are ice cold water immersion. That can be painful in the moment, but hormetic or beneficial by raising dopamine levels afterwards, again, in response to injury. But even anything that requires a kind of sustained effort, prayer, meditation, reading a difficult text, work. This is, again, where we can get into addiction to work when we do too much, too often without taking a break and giving those gremlins time to hop off the pain side of the balance, and for us to kind of restore homeostasis, relax our brains, and not be, constantly be seeking that flow state. The other thing that happens with work is the kind of work hard, play hard mentality. People press hard on the pain side, they work too much, they overextend their physiology. And then instead of the work being over being the natural reward, instead, then they go to the other side. They press on the pleasure side, they drink, they smoke, they use sex as a way to recover from too much work. So now you're talking about a pleasure pain balance that's doing this, right? Each extreme, pleasure pain, pleasure pain. That's terrible for our system because, again, the biological definition of stress is any deviation from homeostasis, or from the level position. Every time we do that and try to correct and get back, we are releasing cortisol, releasing adrenaline. It's an innate stressor. So making sure that we are, balancing our lives and not doing too much of one or the other.
And this is so counterintuitive to a lot of people because many of us have been conditioned, raised to believe that, you work really, really, really hard and then you get into the great school and you get the great job and you buy the big house and the car and the this and it's like there's this reward centered kind of culture.
Right.
Even as you said, to reframe it instead of like I'm giving up my reward of my chocolate at the end of my meal, it's like it's a complete mind shift for many people. So how do we, like, what is your vision for this work? Because I see such potential for the research and people understanding the truth of why we are the way we are and why we think how we think and why it's hard to change sometimes. Like, what is your vision for our world with this work?
Well, I mean, I think we need to do a lot more natural experiments in pursuit of this kind of modern asceticism, where we actually intentionally try to expose ourselves more to painful stimuli that we don't necessarily ration and control to change the way they feel, and also eschew or avoid highly potent intoxicants, at least in too big quantities. So it doesn't mean never using intoxicants, but trying to use them in much more moderation and to pursue a kind of modern asceticism where we're not constantly stimulating our brains with rewards and using rewards essentially to organize and structure our experience, which is what we do now. We, from our first grabbing our phone and our cup of joe in the morning to our Netflix binges and cannabis bowls in the evening, we are constantly tweaking and tinkering our own neurobiology, as opposed to living in a much deeper moderation and not necessarily trying to control the experiences of pleasure or pain on some level, but just sort of letting life unfold. In terms of practically speaking, I've been a big advocate of getting smartphones out of the schools. These are natural experiments that are being done in some schools, and teachers and administrators are describing that schools are noisy again because kids are interacting, they're less anxious, they're less depressed. I mean, so I think that's really important, observational or empirical evidence showing that, hey, how do we really understand a biological system? Well, change one variable in the system and see what happens. We do have this cultural trope that if we are not happy or even in any kind of minimal discomfort, we should seek out comfort and pleasure and avoid pain to make ourselves feel better. I think we really have to counter that narrative and instead almost push the opposite. Again, not advocating for people to cut on themselves or not advocating workaholism or exercise addiction. Those things happen, but really a kind of making our lives intentionally less convenient, less indulgent, trying to live in a kind of a narrower homeostatic range and not trying to constantly tweak and change the way we feel.
So Anna, tell us a little bit about, psychedelics in terms of the impact on the brain. Some people I imagine can get addicted to that too. What are your thoughts about that?
Well, first of all, I think that the media and the sort of social media and bona fide legit media chatter on this is way outside of the actual evidence. So far we don't yet have reliable evidence showing that psychedelics or hallucinogens more broadly are effective treatment for any mental health condition. So I just really want to emphasize that, because we have this narrative out there that, oh, you can use mushrooms to treat, depression, treat anxiety, have a spiritual awakening. And I'm sure, anecdotally, there are certain individuals for whom that has been the case. But if we are going to make a medicine actually FDA approved for general use in the general population, we need much more data, not just on the efficacy of potential benefits, but also potential harms, not just to the individual, but to the broader population. And we are just not there yet. But unfortunately, the message is out there that they are therapeutic. So now you've got, teenagers who are using them to help self-medicate, a variety of psychiatric disorders, some of whom are literally ending up dead as a result. So, I'm very concerned about that. And really, in many ways, the media reporting and even the messaging from some, of the researchers on psychedelics is very similar to what we heard about opioids and the use of chronic pain in the late 1990s as, promulgated and perpetuated by companies like Purdue Pharma and others, which way overstated the benefits, understated the risks, and ignored the public health consequences. So we do not want to make that same mistake again with psychedelics. Also, the evidence that we do have is for the use of psychedelics as a catalyst or adjunct in psychotherapy treatment, not for as the molecule sort of just by itself. So, I'm glad that the research is happening. We need more research, and that's great. But I certainly do not want folks out there, self-administering something that doesn't yet have proven medicinal benefit. If they're going to take it for other purposes and they're adults, then and it's legal, where they are, great. But we got to protect kids, and we got to protect people who are, wanting to use a medicine until we really have evidence of its working as a medicine. We don't want to hold it out as medicinal.
Thank you. And one final question here, and it's about how to support people in our life who may be mildly or severely addicted to a behavior, a molecule of some sort. What is the best pathway that we can take to support them?
I think one of the main things is to realize that people lose agency when they become addicted, which means they literally lose the ability to choose well, because they don't really have access to all the information. And essentially, their prefrontal cortex gets cut off from their limbic brain, and those gremlins just end up driving the bus. So what we can do as loved ones is actually hold a mirror up to them and show them the reality of their behavior by observing to them, hey, this is what I'm noticing. This is how you are when you are using, or this is how you are when you're in your addiction, or even just with our devices. Hey, I'm noticing you're on your device a lot. And when you're on it, you literally disappear. You're not here. And our kids are trying to get your attention and you're not responding. And when you get off, you're cranky and you're irritable. So these are the types of things we can reflect back to each other, because the truth of the matter is we do not see ourselves clearly when we're chasing dopamine. We really lose insight. So being a kind of a mirror to each other is something. I also just recommend that even if you're not sure you're struggling with addiction, but you're kind of wondering, go see a mental health care provider with training in addiction and run it by them. If they don't think you really have that problem, then they'll let you know. And if they do, they can offer you the full menu of options. We have medicines. There's individual and group psychotherapy, there's peer recovery, like I already mentioned, not just 12 steps, but other types of peer recovery if 12-step isn't a fit. So, go get some help from a professional. And then finally, I would say, if you don't want to see a professional, try an experiment yourself along the lines of a dopamine fast. Try to cut it out and see how it goes, see how you do. Gather your own data, so to speak.
Yeah. And I imagine with that is be patient, because maybe the immediate data might, not be what you want to see. But if you stick with it, as you said, I don't know, 10, 15 days longer, then you'll begin to see a shift. So expecting it not to necessarily be rainbows and butterflies in the first few hours or days, or maybe.
Yeah, that's such an important message, because so often patients with addiction think they only have two bad choices: either keep using and be miserable, or stop using and be miserable. So we have to make sure to communicate that there's a third way, which is that they stop using. Initially, they're more miserable because of withdrawal, but if they can just maintain abstinence, they will eventually get to a place where they feel better. So just, again, take that tincture of time, counseling patients, letting them know that the more days they can accumulate, not engaging in their addictive behavior, the faster they'll get to that place where they actually, it gets easier.
And this is the essence, I think, of the message for me, is that the empowerment that comes with that when we know the predictable way that our brains as a human organism, yes, work, and that it's not a maybe this will work for you, it's a certainty this will work if you do it this way.
Yeah, and it might not be a total solution, but you will almost invariably feel better if you
Yeah.
give up your addictive behavior. Yeah.
Yeah. Well, thank you so much, Anna. I think there's a lot of hope being given here today, and a lot of self-awareness, for people to look inward or at others and from that more objective lens and be like, maybe this is an over attachment, mildly entering into addiction land, and might be, as you said, maladaptive, not really in line with my health and how I want to live my life. And that's a very powerful thing to leave people with, that sense of control that they can do something to feel better and to create a better future. So thank you. How can people learn even more about your amazing research, your work, your speaking?
Oh, thank you. I mean, I'm not really on social media, and I don't update my website, which I'm really not good about that. So there may be no place, but this podcast is a good place.
Thank you. And of course, the books. This one I know I've read and sent to many clients, and everyone has found it very, very beneficial, especially those of us who have had an affinity towards something, and some shame and guilt and self-disappointment and all that goes with it. It's really a bright light in our world. Thank you for doing this important work.
Thank you so much. That makes my day. All right.
Well, all my love. Thank you.
Thanks.
Hey, game changers. Thanks for tuning in to this episode with Anna Lembke. I learned so much from it, really about what happens in the brain and the body when we have addictions. And it just brings so much more empathy, for ourselves and for others, and to really understand what it takes. And I hope you learned so much from it that is beneficial for you. Please share with others that may be suffering as well. Hopefully this will give them some hope and some skills to overcome whatever those things are in life that they're struggling with. If you want to access another podcast conversation that could be helpful, it's episode 153 with Dr. Ron Siegel on finding happiness exactly where you are, because I think that's a part of this as well, is really finding that place of ease where we are, and a little bit of the science of that too. So all my love. If you haven't subscribed yet, please do. We'd love to have you as part of the community. Download the Momentum Institute app. You'll have a free course on mindset there, and sending you a whole lot of love.